How can neurofeedback be used to help a child develop out of speech and language challenges? I'm Dr. Trish Leigh. Let me tell you how. Many people don't know that I began my career as a speech language pathologist. So I actually have earned a bachelor's degree in speech and language and hearing, and a master's degree in communication disorders, and a PhD in communication disorders and sciences. And communication's always been in my heart, at the root of what brings quality of life to people. And actually, science proves that communication, the ability to speak and interact with other people, is the number 2 quality of life after health. And that is what landed me here as a cognitive neuroscientist, using brain training to help people with cognitive and psychological and physical issues on top of speech and language issues. So let me get to the point though. What happens in the brain of a child who is struggling with speech and language development is that certain areas of the brain that control communication skills are not functioning properly. Specifically, what happens in the brain when there's a communication problem is that, depending upon the issue, is that either the expressive language area, Broca's area up here, the receptive language area called Wernicke's area back here, or the sensory motor strip that programs the motor control for speech production is running too slow. And what usually happens is there's usually a little combo there of kind of all of that if someone has a more complex communication disorder. So if your child is having difficulty expressing their thoughts and they understand everything that's coming in, likely this area up here is running slow. If they can't understand the directions that are given to them and then be able to react and respond to the directions, then this area here is running slow. If your child struggles with stuttering or apraxia or dyspraxia or dysphagia, which is swallowing disorder, that is an issue of motor command control. So that is across the sensory motor cortex. So what we do at Leigh Brain and Spine is that we analyze a person's brain using a QEEG brain map. And there's a lot of research coming out. Actually, there's older research, but there's a lot of research coming out in the area of communication disorders showing that indeed this EEG brain pattern is at the heart of communication disorders. So what we do is we use EEG to analyze how a person's brain is operating using speed. And if we see that the brain is using too much slow speed in these speech and language areas, we can isolate it to the area that needs to be improved in terms of brain performance pattern. Now, that is the number 1 way that you can bring a speech and language difficulty online as fast as possible, because the way that traditional speech and language therapy works is it's using the mind and the body from the bottom up to reprogram and rewire the area of the brain that's not working as well. And that's what I spent a long time in my career doing, traditional speech and language therapy techniques. And there is still a place for them. So neurofeedback brain training is not a replacement for speech and language therapy. Hear me clear. When someone comes in and I work with someone, we do both of them. I make sure that you have a strong speech language pathologist working from the bottom up, mind and body up. And then we use neurofeedback to train the brain from a top-down approach. And that is a comprehensive approach to bringing communication online as fast as possible. And it works. Anecdotal stories, I think, tell more than all that science mumbo jumbo that I just told you. That's very important for you to know. But at the same time, I've had people, especially children, let me tell you one story specifically of a little kiddo who came in at the beginning of the summer with a severe stuttering disorder. By the end of the summer, his speech was so much clearer. It was almost clear. And his parents had gotten rid of the speech language pathologist because they felt it wasn't working. He was 5 years old, and that's in the critical period of development when the brain is neuroplastic. It's very changeable. So with neurofeedback, and I got him back in with a speech language pathologist, in just 3 months, that kiddo's brain was in a different spot and his ability to communicate was in a different spot, a much better spot. And his grandma came in and she was crying in the waiting room, hugging us and thanking us, because without neurofeedback from the top down, that journey would have been very, very long for him in his stuttering. And I know that from experience. Honestly, that's what has led me to be here using brain-based techniques, because for a long time, I've been a college professor for 25 years in the area of communication disorders. Now it's mostly neuro and cognitive, but back in the day, I am an early interventionist at heart. I worked with young kids and I would always get the toughest cases because I was good. And what would happen would be, I thought to myself, how can I help these kids get better faster? Because this is just an arduous journey of speech and language therapy, using the mind and body of little kiddos to try to rewire their brain. And that is what led me on the journey of neurotherapies in the first place, because I was trying to figure out how I can help these kids reboot their brains more quickly. Neurofeedback is the key to that. And it is a vital part of any speech and language training program. Okay, I hope this helps you out. And remember, control your brain or it'll control you.